roundtable with healthcare partner, Veterans Healthcare Policy Institute, as I mentioned, VHP1. And we are pleased. All of you know May is Mental Health Awareness and also Asian American Heritage Month. And we have guests that are going to give us some great information. Our first guest is Suzanne Gordon. Suzanne Gordon, author, Wounds of War co-editor.
It's VHPI.
Oh, VHPI. Okay, thank you so much. VHPI, which is Veterans Healthcare Policy Institute, right?
Right.
You're right. That's what I thought I said. Okay, very good. I know what it means and what it is. Healthcare Senior Policy Analyst, Veterans Healthcare Policy Institute. Ms. Gordon, how are you today?
I'm good, Cliff. How are you?
Good, good. Thank you so much. Appreciate you being with us. Now, also, we are pleased to have Essam, Attia, Iraq War, U.S. Army veteran, lives in Manhattan, visual artist, and active in Veterans for Peace, Save Our VA campaign, Common Defense, and recently published a column titled as COVID-19 Rages, Will the VA Be There for Future Generations of Veterans? This is extremely important. The discussion of VA staffing and unemployed veterans across the VA. Who would like to start? Suzanne, you want to start off with us, please? Let me just mention this before you do. Your work has appeared in the American Prospect, The Nation, the New York Times, the Washington Post, and many other publications.
Right.
You've authored 2 books about veterans and their health care, the Battle for Veterans Health Care and Wounds of War, the books. You're a senior policy analyst at the Veterans Healthcare Policy Institute. Okay.
I am.
Yeah. Yeah. Go.
And my new Wounds of War is just out in paperback
Okay.
this month, so people can get it from any bookseller or online. And so Cliff, I think that we're very concerned about the impact of COVID-19, of this coronavirus pandemic on the Veterans Health Administration, and it's a lot of people don't know that the VHA has 4 missions. It has clinical care to veterans, teaching, research, and then its 4th mission is to serve as backup to the nation's civilian sector healthcare system in times of crisis like this. And it's done that in Chicago, in Louisiana, in New York, where Essam lives, which is one of the worst hot spots.
Mm-hmm.
And it's really functioned amazingly well, way better than the private healthcare system, because the VA is national, and it's in a national emergency. It really helps to have a national healthcare system.
Sure.
As our private sector system is falling apart. And but the VA has been hampered in fulfilling all of its missions by policies in both the Obama, Bush, and Trump administration. It's worse under Trump, that is leaving it very short-staffed. It hasn't gotten the personal protective equipment. It's actually been sabotaged in getting personal protective equipment. But it really has responded amazingly well, because staff are on salary, so they can be shifted from one mission to another. They can go from one VA to New York or Louisiana or Chicago if they're needed. They can cancel surgeries or elective procedures without suffering any financial consequences, which you don't see in all the hospitals around you, which are losing money because they don't have global budgets and they don't have procedures coming in. So we're very worried about this constant effort to starve the VA of staff, of funding. You're seeing that even now in Congress and in the Senate, where Senator Mitch McConnell wants to exempt the private sector care that veterans get from the Mission Act from the budget caps, but won't do the same for the VA budget. And this is a very bad precedent to set. It's a kind of in-the-weeds policy thing on Capitol Hill, but it's very significant. In the new COVID package, they want to give more money to private insurance companies to do things that the VA could do perfectly well itself, and these are very troubling.
So what's going to happen there?
Well, I think Essam might want to talk a little bit about what he's seen in New York City, which he wrote about in his op-ed about watching the results in a great VA at the Manhattan VA. Essam, do you want to jump in?
Sure. Thank you, Suzanne. Hi, Cliff. How are you?
Fine. Thank you for being with us. Absolutely. Mm-hmm.
Absolutely. So, yeah, I mean, one of the things that I think is really important to recognize is that, I mean, for myself as a veteran and most veterans that I know, the care that we get at the VA is extremely high quality, and especially in how everything is integrated. It's one of the easiest systems to get care from any sort of provider that you can think of, and that's something that I really cherish. You know, like whenever I've been to a private hospital to help with a friend or a family member, go through that system, it's always a nightmare, and you have to worry about what doctor is covered and what doctor isn't covered by your insurance company, and it really adds an extra level of stress. So I really love the care that I get at the VA in New York. But one of the things that I have noticed since the Choice Act and now the Mission Act have passed is the restrictions on budget and hiring practices have really had an effect on the care that we're able to receive in these facilities. You know, I wrote about in the column one experience that I had where I went to see a gastroenterologist, and I showed up for my appointment, and the waiting room was filled to the brim, people sitting on the floors. The waiting room was spilled over into the hallway. Patients had been waiting, sitting in the hallway for hours, upwards of 5 hours. In fact, myself, we didn't even get to be seen. Most people were turned away by the end of the day and told to return another day because they only had one on-site physician for that clinic that day, and they had to see, 100 people or something, which is physically impossible.
Sure.
And if you're going to put those restrictions on an institution, you're expecting it to fail. And I think that's one of the things that is really sad about this privatization push, because the right wing, or the proponents of privatization will use the arguments of the fact that there's a wait at the VA gastroenterology clinic to support the fact that it needs to be privatized. But in fact, if they were just allowed to hire the appropriate amount of staff, which Wilkie has put a freeze on, then we wouldn't have this situation to begin with.
So
what's going to happen there?
I think that we're in a very promising moment for the VA, because suddenly, it's kind of like suddenly everybody's discovered nurses, and I'm sure in Chicago it's the same as all around the country. Everybody's realizing, do you need hedge fund managers or do you need nurses? And no, I think actually you need nurses. And suddenly everybody's discovering the VA too because of its fourth mission. So people who really didn't think much about the VA or thought it was only there for veterans are realizing, wait a minute, it's important for me too. So I think in this moment, people really need to get active and be calling Congress and their senators and saying, we need more money for the VA. I mean, this coronavirus is not going to go away, tragically. I wish it were going to go away. We all wish it were going to go away. But I think there'll be more spikes. There's a lot of foolish or non-policy making going on, and I think we'll see more spikes. We'll see more need for the VA for its fourth mission. And I think, more importantly, a lot of veterans. I mean, among of those, 20 or more million people filing for unemployment, a lot of those are veterans. And if you lose your job, you lose your health insurance, and suddenly you're going to want the VA. If you lose your job, you're suddenly income eligible for the VA. So I think we're going to see a big demand on the VA. So we need to hire more staff. There's a lot of doctors out there and nurses out there who've been laid off and furloughed and who would probably like to come work at the VA. They have done a lot of hiring, but they need to continue. So, any veteran listening in, should really hit the phones and the email and say to Congress, we need more money for the VA. The spending caps need to be lifted, not just to pay the private sector, but for the VA itself.
That's a good point. If someone would like to ask these two experts a question, you know how to do it. 773-591-1690. 773-591-1690. Suzanne.
If I could just add,
yeah.
Sorry.
If
I could just add to what Suzanne was saying, I think
sure.
The point that needs to be really explicit is it's really not just for veterans. This issue impacts society as a whole because of its second, third, and fourth missions to serve as an educational institute for colleges that have medical schools, to do research. Medical research for the nation that ends up being used by medical institutions everywhere, and also to respond in this national pandemic. Like the VAs in the New York area, were taking in private citizens that were not veterans because the private sector hospitals in the area could not just did not have the capacity. And like Suzanne had mentioned, because of the flexibility within the VA, they were able to increase their number of ICU beds much more quickly than the private sector. And, the call to action really, there's two bills out there on the table, if I may,
sure.
that would really play a very big role in changing the situation. One of them is Senate Bill 785, and that is actually something that's going to be really detrimental. It's designed to push more mental health care patients out of the VA system by basically freezing assets, funding for the VA to make sure it spends with private sector providers. So that's something that's going to be pushing more people away from the VA system. And there's another bill, S853, that is which actually would be very helpful if we could get this one passed. It would do something that would be to eliminate the Air Commission, and the Air Commission is actually a group of people that are basically going to go out and determine whether or not VA facilities around the country are up to muster, and if not, they'll shut them down. And
what was the number on that?
Unilateral.
What was the number on that last bill?
Senate Bill 853, elimination of the VA Asset and Infrastructure Review Commission of 2019.
Okay.
Yeah, and I think Essam is so right. That is a bill that was introduced by Joe Manchin of West Virginia and Mike Rounds and the two senators, and this is really would be a disaster. We're going to see a lot of hospitals failing because of this coronavirus. And the VA may be the only thing in your neighborhood, in your city, in your community, in your rural area. And these people want to close the VA, and the bill is they will make a list of all facilities to close, and Congress really has no input. They have to vote it up or down, every single one. So if God forbid, the Jesse Brown Chicago VA were on that list, folks in Chicago couldn't say, no, we need that. You've got to take it off the list. They'd have to vote the whole list up or down, and it would have to be a veto-proof vote. And this is crazy in this environment to even be thinking about shutting a healthcare facility or hospital because we're going to need everything we can get. People are really going to be suffering. Veterans particularly, because they're so susceptible to this disease. They're also going to be needing a lot of rehab care because you don't just get out of the hospital with COVID-19 and like bop up and start running around the block here. You need a lot of rehab. I mean, this disaster is going to be following us for some years, and we've now learned that this is not going to be the last one. I hope we learn our lesson about preparing, because this is way worse than it had to be.
Very good point. Essam, close us out, will you please?
Yeah, I would just like to ask everybody that's listening, like whether you're a veteran or not, to please reach out to your representatives and make sure that they know that this is an important issue to you, because it affects you, whether directly in this moment or not. It does affect the community, which will indefinitely affect you. We need to support the passage of Senate 853, and we need to vehemently oppose the passage of Senate Bill 785.
Suzanne, you want to?
Yeah, and we also need to have people call their congressman and say that in this, or senator, and say that in this new package of relief from COVID, that they should not have private sector insurers having anything further to do with the VA. They don't need that. If they have to pay for private sector care for veterans who need care in the private emergency COVID care in the private sector, the VA is perfectly capable of administering that plan. We do not need any more taxpayer money going to private health insurers.
Well, hopefully things will work out with people such as yourselves. I'm sure there'll be a lot of ideas that will be put forth, and hopefully it's going to get a lot better. And I want to thank both of you. You folks are doing a great job. Thank you for being with us here on the show.